Good evening, everyone. Myself, Singh, Assistant Professor, Media Medical Institute of Nursing at Hospital Bohol. So today I'm continuing the fourth part of the topic, that is minor ailments. And today's video will be minor ailments part 4. So it will be a short topic. So let's start the topic. So in the last part, we have completed up to the abdominal pain up to the mild. Next, in this is the abdominal pain that is in the severe condition. Okay. So as you can see on your screens, so next one is the abdominal pain that is severe condition. It includes first of all, what are the various symptoms? Okay. So first of all is the pain is moderate to severe gripping, and it may be due to appendicitis. Okay. So there can be the condition of the appendicitis, that is the appendix. Okay. So it may be painful. So this pain may be related with the appendicitis. Second sign would be the vomiting. And third one is no stool pass. It will be one of the common of the major signs during the abdominal pain, that there will be difficulty in passing the stool. So no stool pass will be the symptom. Next is distension of the abdomen. Okay, so abdomen will be distended because of the abdominal pain. Next, may have fever. And so there might be any type of infection present in the body. So that will also relate to the abdominal pain. And next is the treatment. Do not give anything by mouth. Refer to the doctor and the hospital immediately. So when the person is feeling the abdominal pain, so diet should be restricted. And semi-solid or the liquid diet must be given to the patient. Okay. Next one is the constipation. That was about the abdominal pain. Next one is about the constipation. Okay. So it includes in the constipation, it is stool not pass by the patient for 2 to 3 days. So that is the condition. What is the condition of the constipation is when there is a difficulty in passing the stool due to many of the factors, like the digestive system is not working in an effective manner, or any of the type of the disease related to the excretory system. Okay, so that may lead to the constipation. It can be from the mild or the severe condition. Okay. Next is the stool not pass by the patient for 2 to 3 days. So this condition is known as constipation. May have lack of appetite. So the patient may not feel hungry, or the dietary pattern should be disturbed. Next, watch for the abdominal pain. That must be present because there is a difficulty in passing the stool. So this must be present. Next is vomiting and distension. And next is advised to take plenty of the fruits and green leafy vegetables, fruits, whole grains, cereals, and food with natural fibers. Encourage people to walk and exercise in order to have regular bowel movement. So the fluid diet is very beneficial because obviously I would say the solid diet or the solid food should be restricted, because there is also we can say that the condition of constipation is there. So the diet should be restricted to the liquid. Next is milk of magnesia, 15 ml at night, as per the agency policy. Okay. So this must be given to the person. Milk of magnesia, 15 ml at night, as per the agency policy, may be given until normal stool pass. And last one is the, if patient vomiting or distension are present and stool not passed for 2 to 3 days, refer to the hospital immediately. And one more thing, we can also give the suppositories in case of the we can say to reveal the constipation. suppositories are the jelly-like substances that is inserted in the anus to reveal the constipation. Okay, that can also be used. That is not written here, so I am explaining about them. Okay, next is heat absorption. Next, heat absorption is that is the excessive heat. The body will be in the exposure of excessive heat. So, by this, there can be the disturbances in the body. Like, first of all, what we can do to manage this is record the vital signs, because if the body is in has exhausted, okay, so we have to immediately check the vital sign. Are the vital organs are affected by the heat exhaustion? If this is present, then the condition may become serious. So we have to firstly record the vital signs. Second is to provide bed rest. Third is give fluids. 250 ml water with 2 finger pinch of salt every hour, or as tolerable. Coconut water or buttermilk may also be given. So that can also be beneficial at heat exhaustion. Next is if unconscious, then do not give anything by mouth and refer immediately to the hospital. And if the patient is, would say, that conscious, then immediately don't give anything by mouth, but immediately refer him to the hospital so that the treatment can be continued. Next is encourage people to drink extra fluids and salt and 8 to 10 glasses of the water during hot weather. And because excessive perspiration can cause exhaustion and water and electrolyte imbalance. So it is advisable that it is very good suggestion during the summers when there is excessive sweating from the body. So we have to drink 8 to 10 glasses of water so that there must not be the fluid and electrolyte imbalance, and we should not suffer from the heat exhaustion. Okay, so that is very beneficial. So likewise, we can manage the condition of heat exhaustion. Next one is the anemia. So, what is anemia? It is the low level of HP present in the body. The blood, we can say that the hemoglobin level of the body is decreased from the normal in the condition, and that condition is known as anemia. It is mostly found in the pregnant women, lactating women. We can say that the young girls and children. Okay. So first of all, how can we manage is assess the HP level, because we have to find out the is it the mild condition, moderate, or the severe condition that is less than 10 gram, refer to the primary health center. Or if we find that the HP level is less than 10 gram, so then immediately refer to the primary health center. Next, advise the person to eat green leafy vegetables like spinach, uh, amaranth, beans, peas, jaggery, egg, and liver. Okay, so these are the food items that are beneficial in preventing the anemia or managing the anemia. Next is advise oral iron and vitamin. Iron is a beneficial constituent that helps to make the RBCs in the body. So that will be very beneficial in preventing the anemia. Okay. Next, get stool examined for hookworm. That can also be a factor. So stool examination must be done for the presence of the to check for the presence of hookworms. Next, patients with bleeding piles, menstrual disorders with excessive bleeding or other bleeding conditions should be referred to the PSC immediately. Likewise, we can say that in any condition where there is a presence of the blood loss, so that can lead to the condition of the anemia. So immediately refer to that person to the PSC or nearby health center. Next, repeat HB test weekly or monthly to a certain progress. And if HB is very low, less than 40%, refer to the PSC or the hospital, and testing is not recommended at the field level. Okay, so HP level has to be estimated or tested, on specific intervals so that we can assess the condition of the patient. So it should be done, and if in the condition it is less than 40%, immediately refer the person to the PS. Women with less than, we can say that the 10 gram per deciliter, and preschoolers with less than 8 gram per deciliter HB are treated for anemia at the PSCCSK hospital. Women in the reproductive age group are given 100 milligram of elemental iron and 500 micrograms of folic acid twice daily for 100 days. So That is the recommended dose under the National Nutritional Anemia Prophylaxis Program. So that is the condition in which we can assess. These are the two criteria, uh, like the less than, if the HB is less than 10 gram per deciliter in case of women and 8 gram per deciliter in case of children or the preschools. So we are giving this dose like 100 milligram of elemental iron and 500 milligram or microgram. You can say that folic acid. Okay. Next is the edema. That was about edema. Sorry, anemia. Next one is the edema. So what is edema? We can say that the edema is the swelling. We can say that fluid swelling. So that can be seen in many of the patients. So what? How can we manage this? Advise low salt oil. Next, second is about intake and output and weight daily. Okay, so we have to manage the intake and output chart in case of the condition of the edema. Each family individual to record intake and output and should be balanced. And if output is very low, refer to the PSC immediately. Next, find out the cause and refer to the PSC. Maybe due to some systematic disease. Edema is mostly due to some of the conditions like the congestive cardiac failure. Anemia, most of the conditions is relating to the heart disease, fluid overload, or any other type of condition that is directly causing the effect on the heart. So, the renal failure, due to renal failure, there edema may also present due to renal failure or due to the pregnancy-induced hypotension. So, vital organs are having a connection and there is an edema in the body. Okay. Next is test urine for the albumin. So we have to test the urine for the albumin, and that is also relating with anemia. And next, give health education to the family to follow doctor's order and medical regimen carefully. Okay. Next are the boils. So what are the boils? Boils are some types of papules, we can say, appearing on the body on the different locations of the skin. They may be what are the symptoms? Raised, tender, red worm swelling type structures may be oozing first. In most of the cases, we can see the pus oozing out from the boils, often on the scalp, leg, arm, thighs, and buttocks. Okay, so these are the locations on which the boils develop on the body. Next, frequent in the release. Okay, and how we can treat this is if skin is intact, apply magnesium sulfate and glycerin paste dressing twice a day. When boils burst, use salt soaps twice a day and apply dressing and bar daily soap and water and each hygiene. We have to maintain the hygiene of that part so that uh, that area, the part, may not be infected. Okay, so these were the boils. Next is the rashes. Different type of rashes or the redness appears on the body due to different, I guess, different reasons. Okay, for example, symptoms: raised, itchy, red patches appear on the skin that we call as rashes. Second, person does not usually look ill, so just on the superficial skin there is the presence of some of the rashes, and the main signs the redness on the skin. And watch for the fever. Consider like measles. If measles rash appears first on the face and neck and then on the tongue. So that rashes can also relate with the measles and it is one of the severe conditions. And ask for the history of taking drugs like penicillin, sulfur, etc. And a certain contact with weed or flower. Okay, so sometimes we get in touch with some of the flowers or the weeds and it, just touch with the body and get tracks. Or we can say that it forms an allergic reaction on the skin and we got different types of rashes on the different parts of the body. Okay, we have to take the history and why these rashes are appearing on the body. Next, how we can treat or manage the rashes are first is cool water will decrease the itch. So itching will be decreased by the cool water. Second, if taking a suspected drug, stop at once. Okay, so if you are taking any of the medicine or drug, just stop for the time because it might be allergic. Okay. Next, apply calamine lotion after cool water bath. So it will give a soothing feeling. Okay. Next, for adults, cetirizine one tablet, that is the anti-allergic tablet. Cetirizine one tablet twice a day for 2 days. Okay, so that was about the rashes. Next one is the chronic cases. Chronic cases like the chronic ulcers that may appear on the body. So how can we manage them? Is clean with soap and water and hydrogen peroxide. That is a disinfectant. Or saline 1 teaspoon salt salt, liter of the boiled water, and apply ointment. As per the standing orders, different types of ointments are available. Next, advise cleanliness and dressing of the wound and refer to the PSG of hospital. Okay, so this is the way we can manage the chronic cases like chronic ulcers. Next is the pediculosis. So this is the presence of the leaves in the head or the hairs, and that causes some itching or the infection in the hairs or the scalp. Okay, so firstly, how can we treat it? Treat whole family at the same time if infested with leaves. So it is obvious that if person is affected from the pediculosis, then there is a risk that other members of the family might be also be having the pediculosis. Okay, so we have to manage all of them. Second one is the benzyl benzoate. 25% is applied on the scalp at the bedtime of 0.5 melatonin. Lotion is recommended to be applied on the scalp for 12 to 24 hours. Okay, so then hair wash has to be taken. Okay, so 12 to 24 hours is the time period for which we will apply the benzyl benzoate. Okay, and the melatonin lotion. After that, we have to take the bath. Next, wash thoroughly in the morning. Eyes must be protected during the application because we are using some of the lotions. Next, eyes must be protected, and regular combing with fine tooth comb after the application helps in the control. And last one is the wash all clothing and bedding in the morning with soap and water and dry in the sunlight. That is the management for the addition of the pediculosis, the presence of the leaves on the scalp and hairs. Next one is the scabies. Scabies is the disease of the skin. Okay, itching on the skin, redness. These are the symptoms that can communicate from one person to another. Okay, so first of all is the secondary infection. If present before starting the treatment for scabies, next scrub well, bath and dry, then apply benzyl benzoate. That is we can say that one of the lotions or the drug, the medicine that can relieve the itching with clean gauze of red pieces from chin down to feet during the night before going to bed. Allow the medicine to dry with the clean gauze of red pieces. Repeat the treatment after 12 hours and further at 12 hours, ask the patient to bath and change out the clothes under clothes and bed sheets including towels used by the patient. Okay, so we have to apply the lotion of the benzyl benzoate. We have to clean the bed sheets of the clothes. Next, infect the clothes to be washed with soap and water and dried under sunlight. Dispose of the gauze pieces or the red pieces for the burning. So the different types of pieces of the gauze by which we have applied the benzyl benzoate of the body, we have to dispose of them so that they might not transfer the infection from one person to another. Next, not effective, then repeat the same treatment second time after 2 weeks. And neem soap can be used for clothing. That is, neem is having a we can say that the characteristic feature that it is very beneficial for the skin. It can reduce the itching. It can also be used in the case of the chicken pox. The person suffering from the chicken pox, it can be used as a antibiotic or antiseptic. The name is an antiseptic, so that can be used. That can prevent the skin from the itching. Okay. Next, if one person has scabies, everyone else should be examined in the family and treated simultaneously. Likewise, I said that it is a contagious disease and can be spread from one person to another. So, if there is a person who is having scabies, then other persons of the family and members of the family must be assessed or observed for the presence of the scabies. Last one is the schoolmates and playmates should be examined and treated simultaneously because the schoolmates always get in touch with that is there is skin to skin touch with the schoolmates and the playmates that plays in the school or in the house regularly. So they must also be assessed for this thing for the stages. Okay. Next is standing orders for the maternal and child health. So these are the last two topics, and after that, this topic of minor ailments will be completed. So last two topics are standing orders for the maternal and child health care. As I already said, and I always said that maternal and child health, the one of the most prominent topics of the community health nursing. Most of the almost all the topics of the national health program that we study in the community health nursing, they are totally based upon the maternal and child health nursing care. Either a single part or whole of the program is based on that. Okay. So, what are the various standing orders for the maternal and child health care? How we can perform? First of all, is to give antihistamine tablets in case of vomiting and nausea due to morning sickness. In case of the stages of the pregnancy, likewise in the stages of the pregnancy, the female can feel the nausea or the vomiting. So we have to give the antihistamines to manage that condition. Okay. Second, in case of toxemia of the pregnancy, advise her restricted salt diet and complete rest. And if there is edema, immediately send her to the hospital. Next is send the mother to the hospital in case of PPH, that is antepartum hemorrhage. That can be a severe condition, that is PPH, that is postpartum hemorrhage. Both the condition can be critical or can uh, make the condition critical. Okay, so there can be the risk of the different types of complications. So send the female immediately to the hospital. Next is if the mother develops fever after the delivery, try to ascertain its cause and give antibiotic medicine and then refer to the hospital. Okay, so what we are studying is the maternal and child. So in this, we will cover both the mother and the child during pregnancy, during delivery, after delivery, and the care of the baby. Next, advise the mother regarding perineal care with soap and water and to use sterile pads so as to prevent the infection because there is always a risk of infection during the delivery or after some of the days. Okay, that has to be managed. In case of the excess milk in the breast, stillbirths, etc., give comfort to the mother and that for the treatment. So that has to be provided. Be observant to any of the abnormality while taking care of the newborn. So we have to check for the any type of abnormalities of the congenital malformation. In case of the and after the delivery of the child, like inspect the infant for the patency of the rectum, penis, vagina for any abnormal conditions. Also see whether there is any defect such as a cleft lip or cleft palate. These are the congenital malformations. Okay. Next, keep the infant at a place with proper warmth. So we have just after the delivery, we have to manage the temperature of the baby. That is very, we can say that very important. In many of the cases, like the baby is having a low birth weight, so we have to provide the kangaroo mother care. Okay, so in which the breastfeeding and the baby will be wrapped around the chest of the breast of the mother. Okay, next one is the take the weight of the baby and record. So likewise, I said the baby may be low, having a low birth weight, so we have to record that. After delivery, initiate the breastfeeding as early as possible within 1 hour. Okay. Next and last is in case of any deformity or disease, refer the patient for further treatment. Okay, so that was about the mainly standing orders that has to be there for the providers of the care to the mother and the child. Okay, next is last one is role of community health nurse in standing orders or minor. So community health nurse, these are you can say that the standing orders have to be completed by or this all of these minor ailments have to be managed by the community health nurse during her visit to the different homes because she usually has to get in contact or she usually can hear these type of problems from the community members. So she has to manage them. So what is the role of the community health nurse? That is an important topic in this. That is the last topic for the today's lecture, and that is also the last lecture for the minor ailments. Next, what is the role? First of all, is the community health nurse should collect following information before providing nursing care. For each of the minor ailments, these information must be collected by the nurse history of the general health of the patient. Second, taking special history of the onset of the disease, its intensity and symptoms. So if there is the presence of any of the, we can say that disease, so we have to specifically check that or have to collect the history. Next is history of illness in the family. Any other member of the family is having the same disease or not. Plain medical history of that person. Next, community health nurse has to find out the actions taken, complications, and any specifications. She should note vital signs. That is the most important thing. Test. She has to assess for the temperature, pulse, respiration, blood pressure, and also she must conduct the urine test because these are the basic tests we have to perform during the home visit, and we can get a lot of information from this. Okay. Next is she should identify the problems and determine the personal needs. Okay. So, what are the main needs of the problems? The community health nurse must also have to find. Next, she should provide nursing services at the standing order. She should consult and vigil on the family. If there is a presence of any type of problem and minor ailment, she must counsel and provide the guidance to that family of the individual. She can implement the referral system because in many of the minor ailments we have studied about that immediately send the patient to the hospital because it will prevent the condition from becoming mild to moderate to severe. Okay. Next, she should disclose the cause of illness, complication, follow-up treatment, and measures. And last, she should do assessment of the organ. So a nursing process, a thorough nursing process has to be followed while managing the mind. Okay. So that was all about today's topic. That was all about today's the topic of the minor elements. So I have completed the minor elements in the 4 parts 1, 2, 3, and 4. So that this video also will be published on my YouTube channel, and that is my uh, channel. That's my personal channel. So this video can be available on that. You can also get this video on our college official page, that is Meena Nursing College. So you must subscribe both of the channels, and you must also get this video on our college Facebook page. Okay, so you have to follow. You must join or subscribe to the channel. Okay, so okay, friends, we will meet in the next week with a new topic. I would try to explain the next topic that I think must be the recording and reporting and reports and reports. That's also an important topic, and usually it is asked in the exams of the theory and as well as it is also important for the practical point of view. Okay, so we will meet in the next week. Okay, okay. Thank you, everyone. Thank you very much.